Hi everyone, welcome to this presentation. My name is Liz Riley. I am one of the lead faculty instructors for Florida National University's Bachelor of Physical Therapist Assistant program. So I just want to talk a little bit more about our program and what we are able to offer and how hopefully this would align with your career goals. So our program is designed as a post-licensure program. And what's nice about that, it allows us to have a broad perspective in a variety of physical therapy topics and take a deeper dive into that, seeing, having it evidence-based. It is limited lecture. We do a lot based on discussions, do a lot of projects, and we collaborate a lot from different perspectives to help really see the different sides. One thing I think which is really nice about an on-learning environment is everyone is coming from different levels of experience from different, could be parts of the state, it could be from across the country in different areas. And it lets us kind of come together and look at different things, see what's out there, see what kind of experiences you have had, and it allows us to network with a broader group of people. So that being said, I want to talk a little bit about myself. So I am originally from New England and I live in Williamsburg, Virginia. I have been a PTA for about 25 years and I've been teaching in higher education for the past almost 10 years. So what I like most when as a clinician though, as well, was I really enjoyed aquatic therapy and I had established a couple different programs. I like joint mobilizations and manual therapy a lot as well. I enjoyed like the orthopedic sports med, but I also really enjoyed working with patients that were complex, so that had like ortho and neuro, and maybe some neuropathy mix in, diabetic neuropathy mix in, or some cardiac considerations to be aware of as well. So I'm a big believer in networking and collaborating and growing your group. I think it really helps, especially in our profession, as far as opening us up for a variety of opportunities. I would say get involved where you can, when you can, and it just helps us expand what we know, always be learning. We can never learn enough. There's so many opportunities out there, and you're really only limited to what you end up getting involved in. So that being said, I teach the manual therapy course. The modalities are pharmacology and rehab, service-based learning and PT, and ending up with our capstone. So going to talk a little bit about each of those courses and hopefully able to tie it all together for you. So the first one we're going to talk about is our modalities course. So in that we learned a little bit more about using ISTM, so the instrument assisted soft tissue mobilization tools. So that can be anywhere from your Graston to your Hawk grips, to your rock blades, enforcing that with different taping techniques and ultimately with corrective movement as well. On top of that, we go into, which has become a big thing, using tools such as like hypervolt. So using a lot of different kinds of percussion and the different percussion attachments as well. So whether that is to help with muscle recovery, or it also can help stimulate the sensory system, if you have somebody that is very upregulated or downregulated. So if you're seeing patients that maybe they tend to have injuries always on the right side, everything's happening on the right side. Well, maybe that you have to look at what's going on the left side and looking at what's going on in some of these diagonal planes. So maybe that can be another tool that's helpful to enforce some of that motor control. And often your patients, they need to feel it, right? So they don't feel like anything's wrong. And so it's our job to find where those faulty movement patterns are coming from. So we also going to talk a little bit more about dry needling. So with that, in the state of Florida, physical therapists are allowed to administer it, and just recently, athletic trainers can as well. But as PTAs, it's important for us to know the mechanisms behind it, what we should be looking for, how your patients should feel hearing what they're saying, also looking at the research as far as what are the training requirements, what are the outcomes they're seeing for different conditions under different circumstances, and coming to our own conclusions of where we see the value with that. So next we're going to talk a little bit more about manual therapy course, and in that we get more into the different types of joint mobilizations, what they're really doing, and tying that together with using PNF, looking at some of the different functional movement screens, whether that is you're trying to dice out pain or you're just trying to dice out faulty movement patterns, and how all of those are tying together. So as we know, just because somebody doesn't have pain doesn't mean they don't have dysfunction. And ultimately, we also know where they have pain doesn't mean that's where the problem is coming from. So we look at some of these different things. Another big thing we look at is understanding a little bit more about fascia, and go into a little bit of Thomas Meyer's work and how fascia is considered another organ, because it is highly innervated in pain receptors and it can restrict how the muscle is going to move. It's that fibrous sheath that covers the muscles. And so some of these different techniques, like the ISTM tools and the cupping, that's designed to kind of release some of those restrictions. And so we're looking at things from your anterior and posterior lines, some of those lateral lines, and also spiral, which is like your diagonal lines. So when you think of that, you think of like a golf swing. That's going to incorporate a lot of different movements going on at once, a lot of different motor control, a lot of different balance, a lot of motor planning. So all the different components that will go into that. So one of my favorite courses here is our pharmacology and rehab course. And what I love about this is it lets us take a further dive into different mechanisms of across the board what's used, and it just helps to me make a little bit more sense as far as from a rehab perspectives what we should see, some off-label use, side effects, important things to know, important things to educate our patients on. So the first being anesthesia. So there's many different types of anesthesia used. We need to know how these opioids work, how they're going to affect our rehab. So they're changing different types of anesthesia techniques and when, how they're being utilized. So it's interesting to learn how the effect it has on our central nervous system and how it's going to influence post-op recovery. So also we look at anti-epileptic drugs. So a lot of that can overlap. A lot of those drugs can also have off-label use for sleep disorders. So you can, and they can be used for different psychological disorders as well. So that's why we want to take everything into consideration when you are looking over your patient's medication list that they are using. We also look at rheumatoid arthritis drugs, osteoarthritis, some of the gel injections that they're using now, some of the stem therapy treatment that's being used now. So all of this is new and being developed, constantly changing. We're using a lot more technology after they have that to be able to support some evidence-based and data-driven results therapy behind making these kinds of medication and injections more optimal for our patients. So we also talk about cardiac meds, a lot of neuromeds, so Parkinson's meds, multiple sclerosis, and CVA, and how those are changing, the new ones that are coming out, how effective those are, and being able to critically analyze a lot of these different things. A big area in our field now is oncology rehab. So we look at the different types of cancer, how to prescribe exercise in different stages of the treatment, different side effects related to the medications that they are on, and just different levels of considerations we need to be aware of. We are we tie this together somewhat with there's a big cancer rehabilitation institute based in Colorado, and we talk a little bit about that for those that might be interested in pursuing that kind of specialty area, or if it is something they would like to be able to provide some education in their community about. So moving on, we get into service learning and PT. And so, what we do there, we really look at the APTA and what their mission is, what their plan is from 2022 to 2025. It's important to see the direction that we're heading in, stay up to date on new technologies that are coming down the pike, new concerns. It gives you a variety of courses that are being offered, talks a lot about the conventions, and even gets a little bit into what the individual chapters are doing. There's some new chapters. So I recently joined one, which is the Innovation and Technology chapter, to understand more about what is new and what is current and how are they using it. Virtual reality, that's another new thing that they're using and seeing good results with. So I'm also in the aquatic therapy and the education section, and I really enjoy reading the articles and seeing what new things are out there on those aspects, how to make those fields better. Um, or if you're able to reach out for a higher or a larger population group, are you able to work crossover the medical and the fitness world a little bit more and get the community centers on board with what you're doing and be able to create a larger impact? So finally, it brings us to our capstone. So the capstone is going to be an evidence-based business plan. So you're allowed to choose whatever you would like. Some of the big things people will choose is starting a falls prevention program. So that can be ortho-based, neuro-based, or a combination for everything. Or you could do sports neurology, so that can include concussion management from either adolescence, the high school, college level, military, any type of really competitive events that you're seeing, any specific sports you're seeing that you would like to provide something for your community there. Or if you want to look at a specialty field such as vestibular rehab, oncology rehab, anything along those lines. But you are free to choose as you wish. What you're going to be doing is creating a business plan to fill some sort of gap in your community or to expand a service. And you have to come up with a budget and a space that you would need to look at what you're going to need as far as staffing, what you're going to need to provide for professional development. So in the physical therapy world, therapist burnout is a big thing. So we have to figure out what is going to be best for retention and what is going to be best. How are you going to serve your patients best? So what is going to set yourself apart from other programs that are out there? What do you see as being challenges and obstacles, and what do you see as being your strengths? So I hope you found this helpful. Again, my name is Liz Riley, and I am a professor with Florida National University. Please feel free to reach out if you have any further questions about any of the courses or anything about the program or the school. I can be reached at eriley@fnu.edu. And again, that's ERILEY@fnu.edu. Thank you very much for listening.